My name is Sinada. I'm certified dental assistant and also expanded function dental assistant. I'm working in dental assistant for about 15 years and I'm really enjoying my profession and I like to educate patients about their dental health. Today we're going to be talking about grinding or clenching your teeth, which also called bruxing. Are you familiar with that term at all?
Not really, no.
No. So, what is happening, patient, when you're stressful, when you drink lots of alcohol or eat chocolate or coffee before bedtime, um, or you're stressful, had a stressful day, at night during the sleep, patient does grind teeth. Or if you have a stressful day, some patient are clenching teeth, and that could cause lots of damage on the teeth. Could grind down um, biting surface on the front teeth, could grind down cusps on the back teeth, and sometimes so severe that patient breaks teeth and needs to be removed, can't be restored at all. It is a lot of force when we biting, clenching without food in between our teeth. Usually, it should be always space in between teeth um, when you're not chewing or swallowing. How you can train yourself, you putting your tongue on front, like on biting surface of your front teeth, so it's slightly like open, and so you train kind of your jaw that you don't clench, you don't close on your teeth. And so, are you chewing gum a lot?
Sometimes, yeah.
Do you feel after that your jaw get tired at all?
Uh, Sometimes.
So, if you do, I would suggest that you kind of cut back with that because your jaw looks like it's getting tired. It could cause also that you start like at night that you start grinding. Did anybody told you that you're grinding your teeth at night?
Mm,
No.
Nothing.
And then clenching. Did you catch yourself ever clenching your teeth?
Yes, I do.
Yeah. So that would be good if you can kind of remember that to leave a little bit space in between the teeth, put your tongue in the front of your teeth, and try not to clench. Kind of be more kind of relaxed and think how much damage you could cause with time. You're a young person, and later on we're gonna sit you in a chair. We're gonna take a look to see do you have any evidence of damaging your teeth. Um, there are some cases when patient comes to the doctor, we can't notice anything, but they do have a symptoms which show that like they are telling us that they're clenching or they're grinding. Sometimes they are aware during the day they're clenching, but they are not aware that they are doing a sleep, doing damage to their teeth. Um, if they have some soreness of their facial muscle or they have a like sore neck, headache, sometimes even shoulders hurting from all this uh, grinding at night, and they feel like all teeth are sore, that they were chewing something really hard. What we suggest usually to put some moist, hot, like washcloth on a side where it's sore. Take some Advil for anti-inflammatory medication to help with the symptoms, and usually after a couple days using that helps patient to feel better. His muscle get more relaxed, and we suggest to avoid like stressful watching stressful like scary movies or watching something that would disrupt sleep or drinking alcohol or a coffee or chocolate, anything late at night. It's not really good because that's cause uh, when you drink coffee, do you drink coffee at all?
I do.
And do you notice that it kind of interrupts your sleep or does anything?
Sometimes, not very often, though.
Yeah, that I would suggest, like like late afternoon, maybe like last sip of coffee or last cup of coffee, and then kind of stop there, so and see how it's gonna affect, or it's gonna do any changes to you. Um, when if you continue grinding, if nothing is done, and like that wash doesn't help you, then we have to take a look and kind of discuss what we should make you a night guard, which is this little plastic device. It's made for upper arch, but could be as well made for lower arch. If you like, you can take a look. It's very comfortable. and fits over your teeth. And then usually dentists decide which arch you should be wearing. Uh, do you did you have braces when you were younger?
Yes, I did.
And do you have retainers that you're wearing?
No, I lost it a few years ago.
Oh, okay, you are not wearing. And you are aware that teeth may shift if you don't wear your. If you need appliance, that's gonna also help to prevent movement of your teeth. The kind of ortho appliance that works for that. So how is night guard made? Usually we take impression of your lower and upper arch and how your teeth fit together, and the lab fabricates per doctor prescription upper or lower night guard. And if you're clenching, there's special day night guard that has a little wire inside. It's really nice and thin, fits over your lower teeth. And then you can also do your daily activities. You can work, you can talk to your patient, you can go to school. Doesn't affect much your speech, and you can still wear that to protect your teeth and prevent you from clenching and grinding at night. And there's other device that could be made on just on a kind of you wear on the front teeth. That's a little piece that you wear, but it's not really good for somebody who's clenching and you have to do your daily activities. You have to work with doctor, patient, going to school, and all those activities. It's not really good. You are not a good candidate if you need one. It's not like maybe that option is best for you. So, would you like to sit down on the chair?
Sure.
I can take a look to see if any damages are there or like already on your teeth.
Yeah, sure.
Please have a seat.
Okay.
I'm gonna just put some gloves on and we'll take a look. Oops. Yeah. I can put some gloves and then. I'm gonna put a bib on you. If you like to have sunglasses, I'm gonna turn bright light.
Sure.
And I'm gonna hand you hand mirror. Okay, let me get the light here. I'm gonna tip you just a little bit back. Here's your mirror. And then we have also sunglasses for you. If you like to put them on, please.
Okay.
Take a look. Are you visiting your dentist on a regular basis?
Every few months I try to. Every 6 months.
Any issue with the decay, cavities?
Nope, none.
None. Nice. Just make sure still that you use mouth rinse, floss, and also brush twice a day to prevent gum disease. It looks like you're resistant to cavity bacteria, but you may not be resistant to bacteria that causes gum disease. So if you can floss and your mouth rinse, that would be great. So I'm going to use my little mirror, and I'm going to take a look to see, and you can take a look in your mirror also. So here I'm noticing that you have a little chip on the front toward the tongue side here. And I'm noticing that your canines, there's like eye tooth, I would say, lost that point, sharp, pointy part of the tooth. So see how flat is that? And then same as here. Here is a little bit less damage, but here's more. And then let me take a look. And then I see a little bit flattening here on the back on your molars. They are not so pointy, those cusps. And I don't know if you're noticing here, but this tooth is overlapping. So this one is moving in, and this one is moving outside. So it kind of overlapping there. So it's difficult for you to kind of brush and remove plaque and also to floss. So it'd be nice to check with your doctor for ortho that you had braces with about what should be done. If he decides that you don't need anything, then night guard definitely would help to prevent movement of your teeth. And then here I can see that you have some damage on biting surface to the tongue side. Can you see in my mirror?
Mm-hmm.
Yeah, so here's the like flat part. So then this part, if you bite on something, may kind of chip off, and it's very difficult to restore. You know, or those chip on the front. Usually we have to file this down or make that. So here, look, canine again, like lost that pointy part, and here same way. So let me see how it's yeah. So I can see like even here like a little almost chip there. So that's why it's really, really important that when you go see your dentist next time, talk to them about night guard, and if you can also try to prevent your clenching because you are aware that you're doing clenching, right? So that would be great. Um, if you don't stop your clenching and you start having some discomfort in your TMJ, then there's option. You can see physical therapist. You know, when you have any issue with your knee or elbow, anything like that, you go to see physical therapist, right? And if you like, you can stay there if you feel comfortable.
Sure.
Same as for if you have discomfort with your TMJ, you can see physical therapist and they can help you with that to get your strength back and prevent you from continue grinding or at least to do less damage to your teeth. If that doesn't help, there is we have to refer you to specialists who deals with clenching and grinding, and they make special appliances for patients that we couldn't help with their problem. If you continue, if you are not doing anything with stopping or preventing you from clenching and grinding, your teeth are going to start wearing down and they're going to be sensitive to cold, sensitive to brushing, sensitive to like temperature, to air. When you breathe in, it's going to start feeling sensitive. And sometimes we have to do root canals on those teeth because it gets so grinded down, the pulp of the nerve of the tooth is exposed and they need to have a root canal, or they break so badly too that can't be restored any longer. So I don't want to scare you, but those are all kind of steps, like what could happen if you don't prevent or don't stop clenching and grinding. So you're young, how old are you?
27.
27. So you didn't have it, you're still young to cause big damage, but I can notice already that you do have some damage. So with aging, with more issue in life, you may cause more. So it's best to prevent and stop that damage in your teeth. Otherwise, we see all the time patients losing teeth because of grinding. They crack tooth in half. They need to be restored. They have to go implant. It's a lot of issues that could happen if you don't stop your grinding. So do you think that you can change anything in your habits and like in daily routine that could help you with the stress and with your clenching?
Maybe try to take my mind off things, not be as stressed out.
Well, the suggestion to go for a walk, do some light exercise, listen to relaxing music, have some like mild tea with no caffeine in there. That helps also to relax before bedtime. And you know, just kind of think positive. That sometimes helps a lot. Like when you're in stress, try to think about your health to prevent damage, permanent damage to your teeth or your muscle on that you have. That could also be damaged by clenching, constant clenching. So, do you have any question regarding bruxing, grinding,
Not,
TMJ, discomfort disorder?
not in particular. Anything regarding costs about the retainer?
Okay.
Or the offer?
There is if you don't have a dental insurance, usually $250 is patient cost, and there's a couple of options that could be care credit card. You can apply for it, or you can meet with our billing person. She can talk to you about the payment plan, so you can do that. And it usually takes 2 visits. You come one day for half an hour visit. We take impression, which takes about a minute and a half for each, for your lower arch, upper arch. It's how your teeth fit together. And then we send case to the our lab, and the doctors decide which arch you're going to be wearing. In your case, you are not missing any teeth. You have all teeth that are existing. So probably he's going to suggest to have on a lower, because you already have some movement of your lower teeth, and you're going to be wearing during a day. That's going to be a special one, day/night guard that you can wear all day whenever you want, when you feel stressed that you may grind or clench. And that's a little bit more increased price, but because you don't have insurance, that's going to be same price when they increase. And then 2 weeks later, you come to the office. We check you bite when you have a night guard in. It snaps really nicely in your mouth. And then we adjust to see when you bite down, it should be all teeth are touching on your night guard. And usually you wear your night guard, like I said, during the day. You can wear to prevent clenching, and then before bedtime. Usually you feel like you have more saliva in your mouth first couple days, which is patient reporting when they come back, which is normal. After a couple days you're gonna feel. Some patients don't like that feeling, having appliance in the mouth, but you remember when you had your retainers, you get used to it. After a while you get used to it, and it's normal for you to wear it. The same with night guard. Patient, like they have it for years, they get so used to it. Like if something happened, they are so they want a new one as soon as possible, because they can't sleep without. They got so used to night guard. And usually night guard lasts for a couple years, but if you have any restorations, any lose, like a loss of the teeth or crowns, anything, in your case, you'll find you just so far never had a restoration, so that wouldn't affect you. But usually if it gets damaged, then could be replaced every couple of years. That's a part of your dental. Whenever you come for your dental visit, you always bring your night guard. We're making sure it fits nicely, and if needs to be additional adjustment, then we can do it that visit. Uh, it is expensive, but when you think, if you break one tooth, like if you need one restoration, how much would cost? And tooth what is restored, it's never like virgin tooth that you've never touched before. So it's better prevention than treatment. It's always the case. That's why I would encourage you to see your dentist, to make some that he can take a look, and we can together decide which type of appliance you need, and we can make that soon for you. And then I hope that's going to help you with your issue that started by, like, it's visible, that's already causing some damage in the teeth. Do you have any other question that I didn't address?
Not at the moment, no.
No. I have a little survey here before we, and also I have a little pamphlet here. So I'm gonna get you this pamphlet and just sit here next to you so they can see it together. So about bruxing, about grinding your teeth. So that's kind of description. So why it is happening, what is causing grinding. There are some images not really pleasant about see how it's like, you can see a second layer of your teeth. You can see like all this yellow, that second layer, that there's no protection, and the enamel is gone by grinding. And I assume this person is very sensitive to everything. And so there's what is affected by bruxing, breaking teeth. They need cosmetic sort of like cosmetic. They cause so much damage. They need cosmetic treatment for their teeth. Otherwise, their teeth look short and really not pleasant to see. And so there are symptoms also, what you should be looking for if you are not sure that what's going on, what is happening with your teeth. And then usually kids, they grind their teeth and they stop usually like when they're teenagers, but some continue to adulthood, so they continue, and like sometimes genetically, sometimes like just they're more stressed. And treatment, we talk about night guard, and if night guard doesn't help, which steps could be taken later on. So I'm gonna get you this pamphlet. Hopefully, it's gonna be helpful for you. And you saw night guard a sample. So that's pretty much what you like. You're gonna just get for lower arch that you can wear during the day. It's a little bit different. I don't have a sample to show you, but it has a little wire on the front, so it snaps on your teeth nicely. That you can talk and still do your activities. And also, I have a little survey about today what we talk about. And if you don't mind to fill this out for me, and then if you have any question, I'll be happy to answer. Or later on, if you can think about the question, so you're free to call me at any point, and we can discuss that and we can talk more about it. Okay? So here's your survey, and so thank you very much for your time, and then see you next time. Bye bye.